is my second reflective journal entry. Today I'm going to be answering some questions. The first question is, discuss a patient interaction in which there was transference, countertransference, prejudices, biases, or judgments that you may be making about patients, or that they may be verbalizing about you. And have you encountered this before? And if so, from where does this originate? Well, during the past few weeks of my clinicals, I have not experienced transference in a patient. Maybe if I had multiple visits with the patient, a transference might have occurred. Transference occurs when the patient directs the feelings about a significant other, sometimes from childhood, maybe a family member, projects that and redirects that onto the provider or therapist. So some of the patients actually think of my preceptor as the guru of psychiatric medicine, and I'm thinking if that could be loosely a transference. Also, a possible countertransference experience for me is with the bipolar patients that my preceptor and I see. I find myself comparing their symptoms and situations against my ex-husband, who was also bipolar. But that's loose interpretation. Also, a questionable judgment bias would be, we had a schizophrenic patient that we saw on the last clinical day, and that patient was there for a medication check. He was very quiet, very, very flat affect, and it just brought back a memory that I had as a RN working in a psychiatric unit, a locked psychiatric unit, in which I was sitting next to a schizophrenic patient that lost control, got loud, hyper-religious, and it just kind of scared me. And I wasn't sure if this patient that we saw the other day was going to do the same thing. So the next part of this question is, would it be appropriate for you to continue to provide care to the patient? And if so, how would you prevent these issues from affecting the care you are able to provide to the patient? Well, I think they're all kind of loose, nothing really severe that I have the countertransference or the judgmental bias for the schizophrenic. So I think as long as the person keeps in mind that not all situations are the same, and you need to just remember that. I think that would help you the most in taking care of your patient in its own special way. Well, thank you, and this is the end of my video.